Hello, this video is the audio recording of the Minnesota Health Care Directive form. I will be reading directly from the form to clarify what and where information needs to be filled in. This is to provide another method to properly fill out healthcare directives, which are critical in case someone cannot make decisions about their healthcare on their own. To begin, right above the first question, they provide a blank for you to put your full name, and next to it, your date of birth. Below that is question 1, which says, I appoint the following person to serve as my primary or main healthcare agent. This person will make healthcare decisions for me if I cannot communicate or make these decisions myself. This question requires their name, the first blank, then their relationship to you, whether it be a family member or a friend, then their cell phone number or another phone number. Underneath is another option, which says, I appoint this person as my alternate healthcare agent in the event my first healthcare agent is not available. This question, is important to note, is not required to be filled out, and only if you have another person you would like to name in case the first person cannot complete their task. This also requires their name in the first blank, their relationship to you, their cell phone number, or another phone number. Question 2 is also optional. It says, I give the following instructions about my healthcare, my values, beliefs, what I do and do not want, views about specific medical treatments or situations. If you need more space, it's important to note that at the end of this form, there is a large box where you can continue to write more broadly or specifically about what you would like. After question 2, it simply asks for your signature and then the date. So the easy part is done. The second part is for confirming you are the person that is making this document. There are two options. You can either go to a notary in the state of Minnesota, or you can have a statement of two witnesses. And this is what this box provides on the second page. For the notary, the notary would have to fill it in themselves and not you, which is also important to note, but I will still read it. For the notary, they must write the county that they live in the first blank. And then in the next says, in my presence on blank date, blank for their name, acknowledge his or her signature on this document, or acknowledge that he or she authorized the person signing this document to sign on his or her behalf. Below, the notary must provide their signature, and then the date their commission expires on the blank below that. To the right, they must also put the notary seal. The second option is to have two witnesses. The first witness must sign their name, then the second witness must sign their name, and then directly below that on that blank, they must print their names. Below that is just some answers to the questions on this document. The first question is, do you have to complete this healthcare directive? And the answer is no. You may complete it today or at a later date, or you can decline to complete it at all. It is completely optional. However, like I mentioned earlier, completing this form will help make sure you get the care you want. Putting your choices in writing helps loved ones know if they're doing what you would want. The second question is, what information are you being asked for? In the first question, above, it asks you to name your healthcare agent. Your agent is basically someone you choose to speak and make healthcare decisions for you if you cannot. Consider naming a family member or friend who knows you well and understands your care decisions and values. Showing your agent this document and talking about it with him or her is very important, so you are both on the same page. Make extra copies to share with your healthcare agent, healthcare providers, and other important people in your life. The second question, which is optional, is a question about healthcare and other wishes you may have. You can be as specific or general as you like. You may include your goals, values, and preferences about medical care, the type of medical treatment you would want or not want, how you want your agent or agents to decide, where you would like to receive care, such as at home or a hospital, whether or not you would like to donate your organs and tissues and eyes. These are all things that you can, but certainly do not have to address in your healthcare wishes on the second question. For the notary or public witness, They must verify your signature on this healthcare directive, which is why the box is there for them. The witnesses must be 18 years of age or older and cannot be your primary or alternate healthcare agent. At least one witness cannot be your healthcare provider or an employee of your healthcare provider. What should you do after you complete this healthcare directive? Tell the people you named as your primary and alternate healthcare agents if you already have not done so. Make sure they feel able to do this important job for you in the future. Give a copy of your healthcare directive to your healthcare provider. Keep additional copies for your records and share with your healthcare agents and family or others as you wish. If you have any questions, you can definitely talk to your healthcare provider, but you can also talk to SEWA, SEWA, which has a website, which was in the link below in the description. Otherwise, you can also talk to the other nonprofit organization involved called Honoring Choices Minnesota. Both will be happy to provide more information about this very important process. Thank you.